The situation constitutes a public health emergency of international concern.
The World Health Organization on Wednesday declared mpox a global public health emergency for the second time in 2 years. The alert comes after an outbreak of the viral infection in the Democratic Republic of Congo spread to neighboring countries. WHO Director General Tedros Adhanom Ghebreyesus.
The detection and rapid spread of a new clade of mpox in eastern DRC, its detection in neighboring countries that had not previously reported mpox, and the potential for further spread within Africa and beyond is very worrying. It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Mpox, which is usually mild, can spread through close contact and in rare cases be fatal. It causes flu-like symptoms and pus-filled lesions on the body. The outbreak in the Congo began with the spread of an endemic strain known as clade 1, but a new variant, clade 1b, appears to spread more easily through routine close contact, including sexual contact. It has spread from the Congo to neighboring countries including Burundi, Kenya, Rwanda, and Uganda, triggering the action from the WHO. Tedros said on Wednesday that the WHO had released $1.5 million in contingency funds and plans to release more in the coming days. WHO's response plan would require an initial $15 million, and the agency plans to appeal to donors for funding.
An escalating outbreak of mpox in Democratic Republic of Congo and its neighbors has prompted Africa's top public health body to declare a public health emergency of continental concern for the first time. But while experts hope that will galvanize a global response, many obstacles remain. Mpox, which is usually mild but can kill, has been endemic in parts of Africa for decades. A new strain, however, appears to spread more easily through routine close contact. According to the Africa Centers for Disease Control and Prevention, over 15,000 mpox cases and 461 deaths were reported on the continent this year so far. That's a 160% increase from the same period last year. A total of 18 countries have reported cases. Benefits of the declaration, according to the Africa CDC, include the mobilization of resources across affected countries, the unlocking of essential funding, and the boosting of surveillance and laboratory testing efforts.
This is not just an African issue.
Here's Africa CDC Director General Jean Kaseya.
And it is in this moment of vulnerability that we must find our greatest strength and demonstrate that we are all learning from the COVID lesson and we are playing solidarity.
Kaseya said there was a clear plan to secure the 10 million vaccine doses the continent needs, including 3 million this year. But sources involved in planning a vaccination rollout in Congo said only 65,000 doses were likely to be available in the short term. They added that campaigns were unlikely to begin there before October at the earliest. That's on a continent where health facilities and humanitarian funds are already stretched by conflict and outbreaks of diseases like measles and cholera. In Congo, there are no vaccines or specific treatments for mpox outside clinical trials. Congo's regulators have approved the use of 2 vaccines domestically, but the government is yet to officially request any. That's neither from manufacturers nor governments like the United States, looking to make donations through global vaccine group Gavi. Speaking at an Africa CDC briefing, clinical diseases epidemiologist Salim Abdul Karim warned that tracing the spread of mpox is also difficult, as it can often be mild. The evidence they have on numbers of cases and deaths, he said, they're just the tip of the iceberg.
Diese Pünktchen, die aussehen wie Flecken.
Genau.
All right, big pinch. All right, I'm just gonna close the needle and you're all set to go, okay? Big pinch. All right, I'm just gonna close the needle and you're all set to go. All right, all set. I'm just close the needle. And you're right. This is good. That's real. Okay. All right, I'm just gonna close the needle.
Ça fait que vous êtes venu pendant que j'étais déjà à la fin. Non, ne touche pas. Je vais te le libérer. Naacha mawiloni mwili mayuli ya meno na chini ya meno. Mimi nakwenda kwanza wapi? Bo, niko nitafika kidogo kusindikiza. Sawa.
Africa's top public health agency has declared an mpox emergency as a new variant moves across Democratic Republic of Congo's borders. The African Centre for Disease Control and Prevention said the viral infection was spreading at an alarming rate. Mpox is transmitted through close contact and causes flu-like symptoms and pus-filled lesions. The new variant of an endemic strain of the virus appears to spread more easily through close contact, particularly among children. Epidemiologist Salim Abdul Karim says the problem may be more severe than thought, that over 15,000 cases and 461 Mpox-related deaths were reported in Africa this year so far. That's a 160% increase from the same period last year. Mpox has been endemic in parts of Africa for decades after it was first detected in humans in 1970. A milder version spread to over 100 countries in 2022, largely through sexual contact. It prompted the World Health Organization to declare its highest level public health emergency. The emergency ended 10 months later as the health crisis had come under control.